person we're missing is Stephanie. There she is now. So so everyone is here.
Give me
a moment.
Start the live stream.
Very good. Yes, thank you. I'll let you know in just a second.
This conference will now be recorded.
We are live streaming, and you can start the meeting, Dr. Bechtel. Thank you.
So I'd like to call the Medical Marijuana Committee together, and the time now is 2:31. The first thing I'd like to do on our agenda is to approve the minutes of the March meeting of the Medical Marijuana Expert Committee. Do I have a motion to approve the minutes? Dr. Reddy? Okay. Second, Dr. Schottenstein. All in favor? Say aye.
Aye.
Okay. I think the way I'd like to proceed is we have expert review by Dr. Albright on 4 subjects, and I thought we would discuss those first, and then have an opportunity for him to comment on those. We do those as a committee, and then we'll officially then as a committee go and look at the other all the qualifying conditions that have been petitioned for. So Dr. Robert Albright is board certified in neurology and in hospice and palliative medicine. And he also holds a certificate to recommend for the medical use of marijuana. And we've had an opportunity to review his really excellent critiques of these different petitions for qualifying conditions. I would want to comment, Dr. Albright, we'll have you speak to these later. They were very detailed, very thoughtful, looked at the medical literature in detail, were evidence-based, and we appreciate the amount of time and effort you put into those, and we'll be coming back to you. The first qualifying condition that was brought forward was in regards to terminal illness. We really had a couple of proposals or petitions for adding terminal illness as a qualifying condition by Weeks and Henry. And we would define terminal illness as projecting less than 6 months of life expectancy or eligible for hospice. And again, the main focus of making this a qualifying condition would be to make patients more comfortable. Dr. Albright points out in his review that some patients lose efficacy of opioids, that over time they become less and less effective in suppressing their pain. In other situations, opioids can produce significant side effects that would necessitate stopping them. And again, they can run into problems with pain and discomfort. And so it was his feeling, it was his expert opinion to a reasonable degree of medical certainty that he would recommend terminal illness or hospice care would be considered as a qualifying condition for the treatment with medical marijuana in the state of Ohio. Dr. Albright, I thought maybe you could address your expert opinion on that a little bit, and then I could open up for questions from the committee. Would you like to comment on?
Yeah, thank you. Thank you, Dr. Bechtel. I guess I would first start out to say that this was probably the more difficult one of the 4 to do. It's a very broad condition. Obviously, it has no receptor studies available. It has no animal models available. It's based strictly on a limited number of clinical trials, but quite a few meta-analysis. And there's no question in the end-of-life population that you run into symptoms or a number of symptoms that can be difficult to manage with the tools that you currently have in your toolbox. So there's not a week that goes by where I am not at least presenting the option to hospice patients that medical marijuana is something that's available, because many of their problems are already on the list that's approved. Not all, but many of the problems are. So I think the issue the part of my recommendation that I want to just also to make light of, let me just get my quote here, is that if standard palliative treatments have failed, patients are having pain in spite of opioids, patients are having nausea in spite of antiemetics. If we're trying to achieve comfort and our standard toolbox isn't working, it's my medical opinion that medical marijuana should be made available to them. Whether that will end up with medical marijuana being used, that's a different subject. But if the board considers a terminal condition as being that it can be addressed under the current regulations, then I believe marijuana should be a tool to be able to be used.
Thank you. Medical marijuana for the treatment of terminal illness is approved by the states of Pennsylvania and West Virginia.
Correct.
I believe Kentucky and Indiana do not allow medical marijuana at the present time. You did bring out another good point that the committee needs to be aware of is that it's possible that some of the components of medical marijuana could interfere with a cytochrome P450,
yes,
causing some interreactions, which could be a potential problem with oversedation and other things, interactions with other ongoing medications. Is that correct?
Yes, that's correct. But again, in the hospice, speaking as someone who actively takes care of a hospice population, you routinely go through the term we use is their polypharmacy. You routinely go through their medications, and again, to be very direct, if it would be approved, I would be looking to the electronic people like Agoraphobia and some of the other electronic prescription companies that we work with to bring to our attention drug-drug interactions.
Thank you. Do any members of the committee have specific questions for Dr. Albright in regards to terminal illness? Dr. Schonstein.
Hi, thank you so much. Nice to make your acquaintance, sir. And I also thank you very kindly for being here and for the reports, which I really valued. With regard to the medical marijuana use in the treatment of terminal illness, I was wondering if in your experience you find it more helpful in terms of providing relief from the existential fears and the psychological trauma that comes along with end of life, or if you find it more helpful for the physical issues, the nausea, the vomiting, the pain.
All right. Straight question. I'll give you a straight answer. It's very rare in a hospice situation that patients can afford medical marijuana. So if you leave that population, most of the patients that I'm managing, you're dealing with multiple improvements from marijuana, including existential. But I will say again bluntly that in my hospice population, which is rural, I'm in Jackson, Scioto, Pike, Waver, Adams, Brown, Highland. Welcome to South Central Ohio, Appalachia. I am 0 for 50 of people being able to access medical marijuana. They just can't afford it. And as I put in the article in my summary, it is not something that's supported through hospice because of the Medicare, the federal limitations.
Thank you.
Thank you, I can't give you a more enlightened answer.
It's helpful. Thank you so much.
The other petition that we'll be dealing with was on spasticity and spasms. Medical marijuana is approved in Michigan and Pennsylvania for the treatment of spasticity. And Dr. Albright really points out that he defines spasticity as an injury to upper motor neurons, the pyramidal system, and not to be confused with persistent muscle spasms. And it is his opinion that for spasticity, that it should be considered as a qualifying condition, but not for the treatment of muscle spasms. And I wonder, Dr. Albright, if you could comment more on that.
Yeah, I have to smile because I talked with Brandy and with Mr. Davis early on in this, and each of the 4 topics touched on a certain part of my training. The hospice was obviously my hospice and palliative. This was straight neuro. I mean, this was textbook neuro. And so you bid on my basic approach to the pyramidal, the extrapyramidal. So I'm sorry if my summary put some of you to sleep. I was concerned, and one of the reasons I went into that much detail, I was concerned because I'm assuming it's Mr. Trefny, not Dr. Trefny. I apologize to him if I'm missing that. But he entitled his request to spasticity and persistent muscle spasms, and that hook set on me right away. Spasticity is not muscle cramps. It's not Charlie horses. It's a pyramidal dysfunction. And if once you define what it is that you're going to be treating, then as I expressed in my summary, I believe you will find the evidence there both from a receptor perspective, an animal model perspective, and a clinical perspective that there is a role. But you have to clarify, I shouldn't tell you what you have to do, but it needs to be clarified, what it is that you're treating and what you're defining as spasticity.
Thank you. Any further questions for Dr. Albright in regards to spasticity? Dr. Schottenstein?
Thank you again. I'm curious, actually, if you see a different degree of response based on the nature of the diagnosis. In other words, if you see more of a neurodegenerative process versus a traumatic process, impacting prognosis and response to the marijuana.
Well, trauma frequently gives you, post-traumatic frequently gives you an upper motor neuron pyramidal spasticity. I am treating a number of people with multiple sclerosis who have upper motor neuron pyramidal spasticity. And I can share with the committee that, yes, these patients are giving me subjective statements of subjective relief and help with some of the control of their spasticity, in addition to many of the other problems that come with pyramidal systems. I have a number of people in hospice who have Huntington's. That will be a side issue that's coming up, which is extrapyramidal. Certainly Parkinson's is extrapyramidal. Again, similar to your first question, since I don't have direct hands-on experience with that patient population and marijuana. ALS is something that's already approved, and I essentially 100% will advise families caregiving for loved ones with ALS about the availability of medical marijuana. And much of that is for the spasticity. But again, I not to be the broken record, but the financial aspects of affording the medical marijuana has proven to be a major factor, more so than misunderstanding of the high feeling and things like that.
Thank you so much, sir.
I thought we would move on now to Huntington's disease.
Bob has a question mark.
Oh, I'm sorry, Bob.
Bob has a question.
Yes.
Just a couple things. I know you cite ALS and multiple sclerosis. I mean, when it comes to the spasticity issue, and I'm not a physician, so I'll apologize. Is that a huge population? Because I think of those as being, huge. Is it a huge population that would be affected by the spasticity when you get out of those indications?
Oh, yes. As Mike pointed out, post-trauma, spinal cord injuries, strokes, anything that affects the upper system, either in the brain or in portions of the spinal cord, will give you spasticity. It is a need to manage. It is a precursor to bed sores, decubitus, pain, contractures. It is a ubiquitous problem. So there is a long list of medical conditions that part of that medical condition involves damage to the upper motor neuron.
And those fall out of the indications that are currently available for medical marijuana.
Oh, yes.
And one last question. I mean, the potential side effects versus the benefits on this. Obviously, you weigh in favor of the benefits, but are there really any side effects for this group that would be catastrophic?
I mean, I will have to fall back to the MS population that I'm working with, and the way medical marijuana is available, and you're as a committee, I'm sure you're aware of this, is that a lot of guidance that the patients receive is from the distributors. And yes, for those individuals who are actively using it for spasticity or other sorts of approved conditions, they will go through various options that are available to them. When they purchase it, they will see ratios, THC versus CBD. They'll look at the ratios, and they will try to minimize, and they get guidance on trying to minimize the side effect profiles. So it's a very individualized, well, it's not really a drug, it's a spectrum of polypharmacy type approach, depending on the amount of THC and CBD that's in it. But you're right, there has to be a definite education to the side effect profiles and what to look for.
Okay, thank you.
The next entity to review is Huntington's disease. Dr. Doug Wu, who's a neurologist with Ohio Health, was the one that put forward the petition as a qualifying condition. Medical marijuana is approved for the treatment of Huntington's disease in Pennsylvania, West Virginia. And I think Dr. Albright was supportive of that also as a qualifying condition when other methods of care have failed, conventional treatments. Dr. Albright, do you want to comment more on that?
Yeah, of the four requests, this one again was more into my neurology background, to some extent in my hospice, because we have unusually large clusters of Huntington's disease in the hospice population. What struck me on this one, and I did include it in my recommendation, in fact, there are clinical trials in this category for marijuana. This is, of the four topics that were given to me, this is the one with the strongest international and national clinical studies on marijuana for this disease. It's a very pure, I mean, you can't get much purer than this. I mean, there's a genetic marker. You either have Huntington's or you don't have Huntington's. So it's a pure condition. And I have to admit to all the members of the committee, I was not personally aware of the extent of research into marijuana in Huntington's disease. It's quite impressive. So in my recommendation sentence, I do state, and this is the only one where I stated this, but I do state that the patient, the family, and the medical team should be allowed to elect medical cannabis therapy after clinical trials are considered, as well as failure to other medications. There are clinical trials available, and I think patients need to be aware of that rather than just saying, oh, go for medical marijuana. I think patients need to have full disclosure that there are trials in this country for forms of cannabis for Huntington's disease. And again, I probably put some of you to sleep when I got into some of the interests that I have as far as, is there sporadic Huntington's? What's the gray zone? The genetics of Huntington's. But sorry, this topic again was it brought out the neurologist in me.
Does any member of the committee have further questions for Dr. Albright? Dr. Schottenstein?
Hi again, sir.
Yeah, Mike.
If you'd be so kind, there notoriously can be psychiatric manifestations of Huntington's, right?
Absolutely.
Anxiety, psychosis, things like that. And marijuana can potentially provoke issues of that nature as well.
Right.
And so is there concern that Huntington's patients would be at increased risk of worsening psychiatric symptoms from the addition of the medical marijuana to their regimen?
I think the answer to that has to be yes, the way you phrased the question. And that's why I would be interested in applying it in looking at what the clinical trials, because Mike, that the clinical trials are going to be looking at that. But the counterpart to that, the other side of that coin is the fact that we're currently using and today, I'm treating Huntington's comfort care Huntington's patients. We're currently using medications that inherently have their own side effects.
Yeah.
Your typical antipsychotics, your atypical antipsychotics. We're reaching into various receptor systems in the brain that are going to have sequelae to that as well. It's a fascinating syndrome. It is truly a fascinating syndrome to try to help people with and try to make them comfortable. I believe that the clinical trials should be the first approach, but if patients are either ineligible or it's not possible for them, I think it would be a potentially valuable comfort tool, not for hospice, not for end of life necessarily, but during the course of dealing with their movements.
Thanks very kindly.
Thank you. Dr. Reddy? Yes.
Dr. Albright, I really appreciate your being an expert for the medical board in these issues for medical marijuana. I just want to go back to the spasticity and persistent spasms, muscle spasms question. Would you think if we said, apart from spasticity, if we rephrase it as saying painful spasms, would you have any comment on that instead of persistent muscle spasms?
Well, you can absolutely get painful spasms linked to spasticity. I see, what do we have? 8, 12, 14, there's 13 other individuals in front of me. I would wager at least one of you has muscle spasms. You wake up in the middle of the night and your calf is cramped up and, you can't get back to sleep because of pain. Those types of spasms or rigors or different types of spasms or even, the types of movements you get with seizures. I mean, I think they just have to be, the clinician has to be aware of the cause of the muscle spasm to say whether or not, it would fall under this category. But yes, you are absolutely correct. And I'm sorry if I didn't.
So the other question I have is, if we clarified spasticity due to neurological conditions causing painful spasms, we could use marijuana. What's your comment on that?
My comment on that would be that I would like as a clinician, I would like a little bit more latitude than a link to painful muscle spasms. So if I have a number of, I don't know how much I want to, I'm into hospice and palliative in large part due to neuromodulation. And in the field of neuromodulation, spasticity is a focus, intrathecal baclofen and things like that. And how I would view spasticity is that I would also wish to be able to consider medical marijuana if I'm dealing with spasticity that could be linked to skin breakdown. I would look for a possibility beyond just painful muscle spasms. Controlling contractures, development of contractures. I wouldn't limit it to simply painful muscle spasms linked to spasticity. I would consider it as a broader application.
The reason I bring this up, because we have muscle spasms not related to neurological conditions, like as you just mentioned, calf spasms, we wake up. It is very, very painful. But
yes,
marijuana is not a treatment for those conditions.
I did not look into that specific question, but I'm not aware that it is.
So those calf muscle spasms, if we start approving medical marijuana, then I think everybody wants it. So I would specifically state that if it is a neurological condition and if it is causing painful spasms, then I would say that, it's appropriate to use marijuana. For localized painful muscle spasms, that's not the treatment.
I agree with that. I would point out, however, that extrapyramidal conditions can give you types of tone abnormalities that people consider spastic. So, but I think that's a discussion that would need to be made by the board. How you define the term spasticity as far as its approval. I think it's from a perspective of a neurologist. I think it's much cleaner to define it as an upper motor neuron process.
Thank you.
Yes, Bob?
Going back to Huntington's disease, again, not being a physician, I look at Huntington's disease and at least the symptoms effects similar to muscular sclerosis. Is that a fair statement, even though their physiological genesis may be different?
I wouldn't link the two. They're very different movements.
Right.
They're very different degenerative processes.
But is the impact similar? I mean, the effect on both of them seem to be loss of muscle control. Maybe I'm being too simplistic on this. I know I'm getting into
I respectfully, looking at patients with Huntington's disease is not analogous to looking at someone with multiple sclerosis.
Not even the effects. I mean, isn't
no,
it?
They're very different. The movements are distinctly different.
But isn't it both of the incapacity of muscles? I mean, isn't the end point the same?
Both of them cause degenerative changes of muscular control. Neither one directly affects the muscles themselves. I mean, it's dystrophy, it's not Duchenne's, it's not myasthenia with the receptor systems there. I mean, in that regard, there is similarity because both of them are degenerative conditions of muscular control, but the effects on the individual are distinct. Maybe a lumper or a splitter, but they are unique to themselves.
Well, I'm sure they are because they're different disease states. I'm just trying to look at from the standpoint of a patient, the effect, backing out the physiological aspects, is going to be kind of almost the same endpoint, right? They're going to have muscle degeneration, loss of ability to use muscles, right?
Both situations will have the end result in both situations will have some similarities. I'm hedging you a bit, but yes, the end results, I mean, there will be atrophy of the musculature, there will be wasting of the musculature, there will be, to an extent, contractures. So in some regards, the endpoints will be similar, but the actual clinical,
right,
the pathway that they take there will be somewhat different.
Right. So the devastation will still be either way. Still be devastation to the patient.
Yes. Yes.
Okay. So
on many levels, devastating on many levels. Yes.
Okay. So I mean, the pros of using cannabis or medical marijuana seem to outweigh any of the negatives in Huntington's. Would it be a fair statement?
I think on an individual basis, that would be a very fair statement. I have to be a little cautious with global statements, but on an individual basis, I think there are patients with Huntington's who would have significant symptomatic comfort relief by access to medical marijuana.
Okay, thank you.
Our next topic, our last expert review was on restless leg syndrome. And in that situation, Dr. Albright recommended not approving it as a qualifying condition. And I wonder if you could just add a few comments on that, Dr. Albright.
My wife has restless legs, so I am empathetic, both for her and for myself, because she has very uncomfortable restless legs. My concern with the approval of medical marijuana for restless legs is because, first of all, I could find no objective data that the endocannabinoid system links to that restless leg syndrome. Secondly, although the application, the submission does reference some clinical data, restless legs it's as common as muscle cramps. I mean, restless legs is an extremely common syndrome. And I did not feel that the clinical data really reflects adequate information of either efficacy, side effects, or, and I couldn't find an animal model of restless legs other than iron deficiency. So as a neurologist, I expressed a viewpoint saying that I really do not feel that there is sufficient evidence at this time that the medical marijuana would have a direct effect on restless legs. Whether it has an existential effect, as far as secondary effect, that may or may not be the case, but I don't think it has a direct effect. I don't think the data supports a statement that it has a direct effect.
Thank you. Any questions for Dr. Albright in regards to restless leg syndrome? Dr. Schonstein?
Hi again, if I may. There are some patients, I think, who manifest restless legs as pain. And I wonder if the marijuana could be helpful for its effect on pain control.
Oh, I agree. Pain control, insomnia, the syndrome of restless legs, as you accurately pointed out, syndrome of restless legs isn't simply the movements. It is a, if it were just the movements, my wife wouldn't be in misery. It keeps her awake. It causes her pain. She has to get out of bed. But the aspect of that is the movements. I mean, that's what's doing it. And in 2021, I could not find objective preclinical support of saying the endocannabinoid system is involved with that particular movement disorder. I can't find it. So whether it would help my wife sleep better, whether it would help my wife deal with the pain and the discomfort, that both could be very accurate, but you're not really treating the movement of restless legs. You're treating the secondary phenomena.
Thanks very much.
Okay.
I mean, the committee may choose to look at it otherwise. Certainly the application, but for what my bias is worth, I think there should be some strong consideration that you're using medical marijuana to impact the endocannabinoid system and getting results from that. I mean, you're using it as a medication in the broadest term. You're trying to impact a condition, and if you can't, I mean, there's a number of physicians on this panel. If you can't evidence that you are targeting, you can't evidence that you are targeting a particular system to have a result, I'm not sure why you would consider using it.
Okay.
My bias.
Thank you. Well, I think to clarify with Ms. Dorsey and Ms. Luca, I think now we want to look at all the qualifying conditions that have been petitioned for Category 4. And I believe it is now the duty of the committee to vote on those as a committee of whether we approve or disapprove. And then, if I'm correct, that will then go to the board then for final yea or nays. Is that correct? Yes.
That's correct, Dr. Bechtel. So we will now kind of shift to the board action where you'll take condition by condition for discussion and proceed with a vote on each condition for a recommendation to the full board.
Yeah. The first condition that is on our list to discuss is the autism spectrum disorder. That has come before our committee previously. We've had new literature that has been produced, and we felt that we would want to review that, the new literature. As you know, autism is a devastating condition for the patients and for the families. Therapy is challenging. It has been difficult to manage many of these patients. And unfortunately, a lot of the therapies that are currently being utilized for autism have significant side effects. And certainly this committee greatly appreciates the concern that families have expressed and the sincerity of the petitions that have been put forward. Our autism specialists and experts at Nationwide Children's Hospital, Cincinnati Children's Hospital, and even some of our mental health directors in Ohio have expressed concern. The concerns expressed by the pediatric autistic experts has been worsening of several psychological or psychiatric conditions in pediatrics, the long-term effect on cognition, the long-term negative effects on potentially the intelligent quotient, the negative effects on ability to concentrate and problem solve, the potential that it may lead to obesity, and it may cause a decline in personal engagement later in life. Dr. Schoenstein, as a psychiatrist, I wonder if you could comment on this also. I know that you help manage autistic patients, I believe, or work with them.
Well, so I would, how shall I say? I appreciate everything that you said. I also regret the pain, the emotional pain that families manage when there are children in the home with autism. But I would say that I'm respectful of the concerns that have been noted by the experts that have weighed in, concerns about there being minimal rigorous evidence, that marijuana is beneficial for that condition, and the substantial association of marijuana with worsening of several psychiatric conditions. And, I don't think it is an exaggeration to say that the Children's Hospital experts express actual alarm at the prospect of approving medical marijuana for both anxiety and autism. They described themselves as deeply concerned and, indicated in their letter that they felt like it would be negligent and unethical to approve medical marijuana for autism and anxiety without the results of good studies that are currently underway to support these indications. So I regret that at the very least right now, approval for autism spectrum disorder and panic disorder with agoraphobia feels premature to me. So I'm going to vote no on those two indications.
Thank you. So I thought we would have an official vote right now on the autism spectrum disorder. All in favor of supporting medical marijuana for the treatment of autism spectrum disorder, say aye. All opposed, say no.
Dr. Bechtel, if I can interrupt just for a moment.
Yes, go ahead.
Sorry, there's a bit of a delay, but we will need a motion from a committee member in a second for that. And I also wanted to clarify, we actually have two petitions for autism. So if it's for both of those petitions, we can clarify that in the motion.
Thank you, Benton. So there really are, again, two petitions. One of those petitions is by Carlisle, and that's for autism spectrum disorder, which includes Asperger's, autistic disorder, pervasive developmental disorder, and then also petition 0167 by Connors for autism. So I thought maybe we could combine our vote on both of those, and we would have to have a motion to approve medical marijuana for the treatment of autism. If we could have a motion.
I'll make that motion.
Okay, by Dr. Soin and second by Dr. Reddy.
I need a clarification. Dr. Nestle, are you saying that you are approving medical marijuana for autism?
We're just making a motion for approval, correct?
I believe
then we would vote on that motion.
Then you can vote yes or no based on your opinion. So at least it ends up, on the table.
So the motion is to bring it to the table for a vote. So we need a second.
Oh, I'll second.
Okay, Dr. Schoenstein. So we have a motion and a second to approve the use of medical marijuana for the treatment of autism, and then and that's Connor's proposal, and then autism spectrum disorder, that's Carlisle's proposal. We're going to vote on those both at the same time. All in favor of the use of medical marijuana for autism, say aye. All opposed, say nay.
Nay.
No.
Nay.
Nay.
And the nays carry. We next will go to the proposal for restless leg syndrome. We've heard testimony from our expert in this matter, and I will need to have a motion for approval of medical marijuana for the treatment of restless leg syndrome.
So moved.
Okay, and second?
A second.
Dr. Reddy seconds. All in favor for the treatment of restless leg syndrome with medical marijuana, say aye. All opposed to the treatment of restless leg syndrome with medical marijuana, well, actually it would be all those opposed to the treatment of restless leg syndrome with medical marijuana, say nay.
Nay.
Nay. The nays carry. We'll now go to Huntington's disease. We've heard the expert testimony from our expert on this matter. I will need a motion for approval of the treatment of Huntington's disease with medical marijuana.
Move it.
Moved by Mr. Gacaloni, seconded by Dr. Reddy. All in favor of the treatment of Huntington's disease with medical marijuana, say aye.
Aye.
Aye. All opposed, say nay. The motion carries for Huntington's disease. We now go to panic disorders with agoraphobia. This has come before our committee before last year. There's been new medical literature that's been presented that we reviewed. Does anybody want to make any further comments before we go ahead with the vote? Dr. Schottenstein, would you like to comment again?
I mean, just to reiterate that I'm respectful of the expert opinions that we've seen, and also just to say that, for some patients, medical marijuana can provoke severe panic. And so I just don't have a comfort level, personally speaking, recommending it at this time for fear of aggravating the underlying disorder instead of treating it. And unfortunately, there's no way I know of to predict who would potentially experience a benefit from it and who would potentially suffer a severe reaction that would end them up in the ER. I just, on balance, don't feel comfortable going forward with it right now.
Any further discussion? Do I have a motion to approve the use of medical marijuana for the treatment of panic disorder and agoraphobia?
Move.
Dr. Schottenstein, second.
Second.
Mr. Gacaloni. All in favor of approving the use of medical marijuana for the treatment of panic disorder and agoraphobia, please say aye.
Aye.
All opposed, say nay.
Nay.
Nay. The nays carry. We'll now turn to terminal illness. There were two petitions for qualifying conditions for medical marijuana for terminal illness. They're very similar. One was defining terminal illness as less than 6 months of life expectancy. The other was less than 6 months of life expectancy with eligibility for hospice. I thought we could vote on both of those at the same time. You've heard the testimony of our expert witness. Do I have a motion to approve the use of medical marijuana for terminal illness?
I move that.
Dr. Reddy, it's moved. Do I have a second? Dr. Soin. All in favor of using medical marijuana for the treatment of terminal illness, say aye.
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 Aye. All those opposed, say nay. The motion carries for approval. And the last illness that we'll deal with that has undergone petition is for spasticity and spasms. Our expert reviewer was in favor of approving medical marijuana for the treatment of spasticity, but opposed to qualifying it for the use of treatment of spasms. Any comment on that? Any further comment from the committee? So I guess, Ben, did you want to comment?
Oh, no, I didn't have a comment.
Okay. So I think that what we would need to do in this situation is maybe move forward with a motion on spasticity and spasms, and then maybe vote separately on spasticity. So we can break those out. Would that be correct, Benton?
I believe so. Yes.
So, thank you. So I'd like to have a motion on approval for the treatment of spasticity and spasms with the treatment with medical marijuana. Do I have a motion?
I move that.
Dr. Reddy, a second? We have a second? Dr. Stein?
Second.
Mark, just a clarification for the non-physician here. You know, we talked about a lot of things on spasticity, and there was spinal cord injury and stroke. I understand that. Are we talking about that group here? Are we talking about spasms that doesn't seem as intense? I just want to make sure that I'm voting this correctly or not.
Yeah, as Dr. Albright clarified, he would define spasticity specifically, and this is as a neurologist, is injury to the upper motor neuron system, to the pyramidal system. And that is where he would define it as a qualifying condition.
Okay, so that would be categorized as your strokes and your spinal cord injuries, right?
Mm-hmm.
Okay.
He did not favor approving it for just muscle spasms, leg cramps, and things like that. My thought would be that we would vote on spasticity and spasms first, and then depending on how we vote, then consider just spasticity alone, if that seems appropriate. So I'd like to, Ben, do we have a motion on that yet for spasticity and spasms?
We do. It was moved by Dr. Reddy and it was seconded by Dr. Soin.
Okay, thank you, Ben. So all in favor of medical marijuana for the treatment of both spasticity and spasms, say aye.
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 And all opposed say nay. So just to clarify, if you say aye, you approve it for both spasticity and spasms both. If you say nay, we don't support either. Michael?
We're talking about spasms as a manifestation of upper motor neuron insult.
No, we're talking about just spasms in general.
You're talking about peripheral motor nerve?
Yeah.
Do you want to just split the vote into just spasms and just spasticity, perhaps, instead of the entire petition together? Maybe separate the petition into two separate votes.
That sounds good, yeah. So why don't we, first of all, vote on spasticity. And again, to be clear, we're dividing spasticity as injury to the upper motor neuron system, the pyramidal system. And this was supported by our expert witness, Dr. Albright. All in favor, say aye.
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 All opposed, say nay. So
I'm sorry, could I ask for a motion and a second prior to the vote, please?
Moved.
Second.
Second by Dr. Schonstein.
Got it. Thank you very much.
Okay.
And if you could now do the voice vote again.
Okay, so the voice vote now will be for the treatment of spasticity, which is injury to upper motor neuron system to the pyramidal system. All in favor of the use of medical marijuana for the treatment of spasticity, say aye.
Aye.
Aye. All opposed? So the motion carries. We will now focus on the treatment of muscle spasms. This is outside the upper motor neuron system, would include like muscle cramps and things like that. We will need to have a motion for the treatment of medical marijuana for the treatment of spasms. Do I have a motion?
Move.
Mr. Coccoloni, second?
I second.
Dr. Reddy. Okay. So we're now.
Oh,
You froze.
Uh-oh. Hopefully he'll, like the last time this happened, it might come back in a little bit. There he goes. Are you with us, Dr. Bechtel? I'm sorry, Dr. Bechtel, you froze for a little while there, just before you called for the vote. Pardon me, we have a motion in a second. But you seem to be back with us now, so we can vote if that's okay with you.
Okay. So again, to make sure it's all clear, and I apologize for the delay, we're voting now on spasms only, the use of medical marijuana for the treatment of spasms. All in favor say aye. All opposed say nay.
Nay.
Nay. The nays carry. Any other comments or discussion before our committee? We'll be presenting our votes, Ms. Luca, then to the board next month for their official consideration.
Yeah,
so,
that is correct.
So I think this concludes the meeting of the. Michael, yes.
forgive me. I was just going to say, if someone from the staff would be so kind as to reach out to Dr. Albright, he just sort of jumped off and we didn't get a chance to thank him, and just give him our thanks. I'd be grateful.
Yep, we'll follow up.
I agree with that. His expert review was extensive. It was medically evidence-based, very thoughtful. It looked at not only what was being done in the United States, but in Europe, looked at what's being done in surrounding states. He put a tremendous amount of effort. It really led to really quality reviews, and I really appreciate all that he's done.
Yeah.
So this concludes the meeting of the Medical Marijuana Committee. All in favor say aye.
Aye.
I can be opposed. Okay.
If you would like a motion to adjourn, someone would have to make the motion if you want a motion. It looks like Dr. Soin is making the motion.
Dr. Schottenstein. And
thank you
Dr.
very
Soin.
much.
Okay.
And then voice vote.
All in favor say aye.
Aye.
And opposed say nay. Okay. Thank you very much. Thank you, everybody.
This conference is no
Thanks,
longer
everybody.
being
Nice to
recorded.
see you.
Thank you, everyone.
All right, thank you.
Take care.
Thank you.